Hello, everybody. Thank you for joining us today on our first session with a three-part series, Building Trust and Partnership with Teams and Families in Long-Term Care with a Relational Approach. Your microphone is muted today, but if you have any questions, please type them into the chat box. We'll get started shortly in about 1 minute. Thank you. So we're going to get started now. I just wanted to remind everyone that today's session is recorded and we'll be sharing the slides and link to the recording in post-webinar email in the days following the webinar. Next slide. So before we start our session, I want to take a moment for land acknowledgement. We invite you to take a moment to reflect on the lands where you are. And if you're not familiar with that, you can visit on the link that we're going to start sharing in the chat box below. I'm coming to you today from London, Ontario, which is located on the traditional lands of the Anishinaabe, Haudenosaunee, and the Lenape peoples, on lands connected with the London Township Ensemble Treaties of 1796 and the Dish with One Spoon Covenant Wampum. At OCO, all of our work is carried out while acknowledging the Indigenous peoples of all lands that we are on today. This land is home to many First Nations, Métis, and Inuit peoples, and acknowledging reminds us that our great lands living is directly related to the resources and friendship of Indigenous peoples. Next slide. So this is our agenda for today. We will start with a welcome and an introduction to OCO. Then we'll pass it to Deborah Bakhti for our presentation. If you have any questions throughout our presentation, please type them into the chat box. We will have about 10 minutes at the end for questions and discussion period, just before we wrap up our webinar. Next slide. Again, welcome to our webinar today. If you can take a moment to please introduce yourself in the chat with possibly your name, your role, and the organization that you're coming in from, that'll be amazing. My name is Fardosa. I am the Knowledge Exchange Lead for the Essential Care Partner Support Hub, and I welcome everyone today. Next slide. So this is an OCO, an overview of our OCO. So at OCO, the center of our work is around caregivers. The diagram that you see on your left shows how OCO works to improve the lives of caregivers. So at the Essential Care Partner Support Hub, most of our work sits at the system outreach and collaboration, but we also do public awareness, caregiver insights and engagement, as well as holding multiple webinars for caregiver and public information, and holding different programs and services for caregivers. At OCO, we also collaborate with caregivers to create our programs and services, which are all free of charge. And we do this with caregiver advisory panel and working groups. I'll pass it to Kaylee, who's our implementation lead, to take on the next slide.
Thank you, Cardosa. So we thought it might be helpful just to share a bit of sort of an origin story of the Essential Care Partner Support Hub and speak a little bit about our work with long-term care homes to date as well. So prior to the year 2020, we saw a growing body of evidence emphasizing the key role of caregivers across all settings. But in March 2020, the COVID-19 pandemic certainly presented a lot more knowledge around the value and role of caregivers. We saw widespread restrictions to visitors in long-term care in an effort to reduce transmission, but this resulted in significant harm not only to residents, but to caregivers, healthcare providers, and organizations as a whole. The term essential caregiver or essential care partner was introduced in mid-2020 as homes were permitted to gradually and carefully resume visits under specific conditions. And fast forward to April of 2022, and caregivers were formally recognized as integral to resident care and quality of life through legislative changes to the Fixing Long-Term Care Act and then the national standards for long-term care. Following this, in March of 2023, the Essential Care Partner Support Hub was launched in a formal partnership with Ontario Health to support long-term care homes and hospitals to implement caregiver-inclusive practices and essential care partner programs. Next slide, please. And essential care partner programs provide a strategy to advance resident and person-centered care. And we love this image from the National Standards for Long-Term Care, as it situates the essential care partner right beside the resident in the center of this image. highlighting the importance of integration and collaboration with essential care partners to advance resident-centered care. Next slide, please. And that is what we aim to do at the Essential Care Partner Support Hub. So we support long-term care homes and hospitals with developing and implementing essential care partner programs and practices that identify, include, and support essential care partners as part of the care team. At the Support Hub, we offer learning and educational opportunities such as this session today, specialized tools and resources, opportunities to collaborate with others in the sector, and guidance and support from our implementation team. If you haven't already, we really encourage you to connect with our Essential Care Partner Support Hub to learn more, and we can share a little bit more about what we do. But now, without further ado, I'm pleased to introduce our facilitator for today's session, Deborah Bhakti. Over to you, Deborah.
Hi, everybody. Thank you so much, and welcome to this first of three sessions that we're going to be doing together, all about building trust and partnership with teams as it relates to the relationship with staff and families. And so I just want to start by just setting the table for what we're going to be covering over the next 3 weeks. So today I'm going to be sharing with you this relationship strategy between staff and families. We're going to talk a bit about admission anxiety, or if you refer to it as move-in day, move-in anxiety, that both families and staff can feel, as well as the 3 gaps that once we're able to really focus on those 3 gaps and work to close them, we can reduce the admission anxiety and increase the level of trust and partnership. And then next Wednesday, we're going to be talking about the narratives that both families and staff can have as it relates to their roles and coming together as partners in care. And then session 3 on February the 28th is all about clarifying and managing expectations. And if you've ever had a circumstance where you kind of get the sense that the family is disappointed because of an unmet expectation, you're going to really get a lot out of that session, because we'll also be providing you with some tools and how to really be able to help close those gaps and clarify and adjust and manage expectations. All of you should have received an email with the link to this workbook. And for each of the next 2 sessions, you will get an additional set of pages that you can add to this workbook, so that by the time that we're together for the 3rd session, you'll have a full workbook that you'll be able to make your notes in. I'm also just want to give you a heads up that before we break for Q&A, I'm going to be asking you a question, which is the last page of the workbook, which is, what's one thing that you're taking away from this program that you want to take action on? Because knowledge is great. And really what we want to be doing is integrating this new knowledge to create the transformation that we're looking to create. So I'm going to be talking about this design your care team and family relationship strategy. I suspect that if you work in long-term care, there is an employee relations strategy, there's a labor relations strategy, and you also do have a strategy as it relates to how you onboard and admit new residents. But in the years that I've worked in seniors care, I see there being a real opportunity to get intentional about designing the strategy as it relates to how we build the relationship with our residents' families. And it really has come in the forefront through COVID and a lot of the challenges that we all experienced, to recognize how important this is. And I wanted just to create a bit of a framework for our time together today, is to share 3 core principles that relate to this. And the first is onboard your families right from the start. And that double entendre is intentional, in that if we can be intentional with a well-designed onboarding way that we're going to onboard our families right from the start, that very initial impact impression that we're making with them, and having the right processes and tools to do that. The second is related to build your culture on the way in, one family at a time. So the average long-term care home has about half 50% of their residents who will leave every year, primarily through death, sometimes through transfer. But the other side of that is that every year you're going to have half of your resident and family population who are likely new in your environment. So when we look at the idea of every time you are meeting a new family and resident, you are building your culture on the way in, one family, one conversation at a time. Going back to the importance of onboarding your families right from the start. The third is take the lead and be the guide your families need and want. And what I mean by this is, I mean, there are times when families are first moving their loved one into long-term care, their head's spinning, they're not even sure which way is up. They're not even sure what kind of support that they need. And so with this idea of having a staff and family relationship strategy where you're onboarding them right from the start, building your culture on the way in, that gives you the opportunity to design that relationship in such a way that you can take the lead and be the guide and take them metaphorically by the hand to be able to help guide them in this new world that they know pretty much nothing or very little about. So I want to just take a moment to introduce myself to you for those of you who don't know me. My name is Deborah Bakhti, and I worked as an executive in seniors care for 11 years. And during the time that I worked in that role, I became a family member on 3 different occasions. The first time was with my dad, and this is back in 2010, 2011. My dad had been diagnosed with Parkinson's and Lewy body. My mom had been hanging on by her fingernails for the last couple of years, trying to maintain his care at home, in amongst numerous hospital visits, ambulance rides, and all of that. And I finally was able to convince her that it was time that she needed to move my dad into long-term care. And it was a horrible decision for her because he made her promise years ago to never put him in a long-term care home. Or I think he referred to it as an old folks home. And so we were able to move my dad into long-term care, where he lived for 6 months before passing away in 2011. Now, ironically, at the same time, I was dealing with my own crisis with my own husband. And he had an acute episode that landed him in hospital. And the neurologist that ran all of his brain scans came into our room and said something that I don't think we would ever, any of us would want to hear. He said, all my years being a neurologist, I've never seen anything like this. I have no idea what's wrong with him. All I can tell you is that he has, as he called it, an unusual brain disorder. So book an appointment and we'll see what we can do. That was the start of a 2-year journey, just trying to get a diagnosis for my husband, Ty. And it ends up that he was diagnosed with a disease that at the time, only 400 people in the world had ever been diagnosed with. We cycled through home care, adult daycare, community care, all of those supports. And it was this one fateful day that our, at the time, CCAC case manager sat me down and said, Deb, you can no longer take care of your husband at home. You've got 2 kids going to school, you're working full time. Our kids were 11 and 17 when their dad first got sick. You need to get him on the crisis list and he needs to be placed into long-term care. Now, remember, I was working in the industry. I was very familiar with the full spectrum of seniors care. And in that moment, I'm thinking, you've got to be kidding me. This is the only option. And so this is back in 2011. So moved very quickly, crisis list. I'm driving home from work one day and I get the phone call that says, there's a bed available. It's in one of your choice homes. Can you tell us now, or you've got 24 hours, but you've got to make the decision. And then within making the decision, as all of you know, it was 2 days, maybe 3, that I was moving him into care. So we moved Ty into long-term care in 2011, and he passed away in 2015. So he lived in long-term care for 4 years. I was still working in my corporate executive role. And then I made the decision in 2017 to leave my corporate role and start my company that I've been operating for the last 7 years. Because the number of conversations I was having with colleagues and other families, I felt that a big part of my work is to really revolutionize relationships in seniors care, and in really focusing on that relationship, that key important relationship with families, essential caregivers, and with staff and leaders. So I wrote a couple of books. My first one, Recipe for Empathy, 6 Strategies to Transform Your Families into Fans, as a resource for staff who were looking for ways to be able to build trust, respect, and partnership with their residents' families. And then my second book, Now What? Managing the Emotional Journey of Long-Term Care for Families, really was to create a playbook for families to help close some of the gaps, the 3 gaps that we're going to be talking about in a few moments. Just late last year, I launched a new podcast called The Empathy Exchange. And I decided to do something a bit different. I wanted to create a podcast for both audiences that are so important to me, people who work in seniors care and families. So whether it's a solo episode or with a guest, we're looking through the lens of both key partners in this relationship. So I want to jump into this concept of admission anxiety that both families and staff experience. And I want to start by sharing my experience of my admission anxiety with my husband, Ty. So as I mentioned, it was a very quick process to have him accepted and placed into long-term care. And I remember the night before we were moving him into his new home, I don't think I slept much, if at all. The tossing and turning and the ruminating and the worrying. And I just kept thinking, I can't believe that this is actually happening. My 63-year-old husband is moving into long-term care. He's going to move into a semi-private room with a man he's never met. They'll be divided by a curtain, and they'll share a washroom. And I knew with his disease process, from what we had already seen and how it was declining, that he's going to get to the point where he's going to need other people to dress, feed, and bathe him. And the stark reality that really slapped me in the face was, I am moving my husband to a place where he is going to live until he dies. The next morning, get Ty ready and the stuff that we were going to be moving in on the first day, and pull into the parking lot of the home, and I help him out of the car and get him into his wheelchair, and we're pushing him up to the front doors. And I'm thinking, is this really, am I making the right decision? Is this the right thing for Ty and for his kids and for me right now? And I continued on, and we got through the front doors, and I went up to the reception and introduced ourselves. And she said, "Oh, yes, that's right. We've got a 10 o'clock admission today. Just head down the hall, turn right. You'll find elevators, go into the elevators, go up to the second floor. And then as soon as you get out, turn right, and then it's a sharp left. And then there's a door on the right. Just go into that meeting room and they'll meet you there." Well, I'm a little directionally challenged. That was a lot. And I think I probably had to ask 1 or 2 people on the way. And we finally got settled into the room. Now it's a room with glass behind us. And so I could see behind us that there's residents and some staff, and they're chit-chatting and watching TV. And then to the right, where the door is, there was a window, and I could see the nurses station and staff and residents wheeling and walking by, and the call bells and all of the sounds and activity that happens in a busy long-term care home. And I'm sitting on the couch, My husband's beside me in his wheelchair. And I'm just feeling oddly anxious, like I'm just vibrating with nervousness. And I'm thinking, long-term care homes aren't new to me. I've been into dozens and dozens of long-term care homes throughout my career. But it was sitting there and I realized this is personal. I am there as a family member. This is not part of my work. And it felt profoundly different. So I kept checking my watch because we got there for 10, our meeting was at 10, it's now 10 after 10, quarter after 10, it's getting on to 20 after 10. And I'm starting to think maybe we're sitting in the wrong room. And just in that moment, the door flies open and about 5 or 6 staff come tumbling into the room. Is that how it felt for me? And the first one comes up to us and says, I'm so sorry that we're running late today, but there's so much going on in our home today. Now, if my face is giving away what my inside voice was saying, because I didn't say it out loud, but I thought to myself, you've got to be kidding me. Do you have any idea what we're going through today? It was this feeling like this has got to be one of the hardest, most heartbreaking days of my life. And this felt like we were being squeezed into an already busy day for them. They sat down in front of us and the DOC opens up this big black binder that had Ty's name on the spine and start asking the questions, right? The questions like, does he prefer a bath or a shower? Let's review his medications. What kind of food does he like? Does he have any allergies? And the questions just continued on. And I could see boxes getting checked and blank forms getting filled out. And it felt so transactional. It felt like we were these little widgets on a production line getting processed. And then they asked the question that I know that you don't like to ask, but it's required. Again, I understand the business. If something happens to him, do you want us to resuscitate him? And he's sitting right there. It took all of my focus and energy to not just break down and lose it in front of these strangers, because at this point in time, they were strangers to me. So I just took a deep breath in, waited for the meeting to end. And it was at that point that it was already noon time to be able to take Ty to the dining room. He'd meet his new table mates. He had a seat assigned there. And as I walked out those front doors, it felt like I had these weights, like cinder blocks on my shoulders, pushing me down, and I could barely catch my breath. And I just kept thinking, like, now what? I have no idea what's going to happen next. And I got in my car and I drove home and sobbed the entire way and barely remembered the drive home. That was my admission anxiety. And I've talked to many families who've had their version of admission anxiety. Like one family member who said in an ashamed kind of way that she had to fib to her husband that they were going to a doctor's appointment because she was so anxious about not being able to get him in the car for the meeting because he wasn't capable of understanding what was happening. Or people just feeling this immense guilt around having to make this decision. And a lot of times families aren't even recognizing the emotional journey that they're going on because they've been so bogged down with all of the just trying to navigate a complex healthcare system. So, and I'd be curious if there's any family members on the call, if you also felt your admission anxiety, and feel free to put a comment in the chat. But the other side of the coin, and I had no idea that this was even a thing, for the whole time, for the 11 years I worked at corporate in seniors care, that staff also feel admission anxiety. And there are three specific areas where I've seen this admission anxiety really emerge. And the first is as it relates to the resident. There's anxiety around what's the resident, how are they going to be, and how the paperwork that a home gets that describes the resident. Have you noticed that sometimes the information on the forms don't actually match the reality? Sometimes it's that time has passed, and when those forms were completed, the individual was using a cane, and now they arrive and they're in a wheelchair. So there's this worry about the level of care and is the information up to date and accurate. The second area of admission anxiety is around the family. What's the family going to be like? How much do they know about long-term care? How are they feeling about making this decision? Are they going to be easy to work with? Are they going to be pleasant? Are there going to be challenges or frustration and friction because maybe they have these expectations that we're not able to meet? Have you ever been in a situation where you know the resident and family coming in and other staff have come up to you to say, have you met the family? Do you know what they're going to be like? I hope they're going to be good to work with. So there's anxiety around the family dynamic. And then the third area is around the admission process itself. Sometimes the admission process, things go wrong. Sometimes the residents coming from hospital by ambulance and they're supposed to be there at 10 and they don't arrive till 3. Or you take the resident and family to the room and maybe the nameplate hasn't been changed and the previous resident's name is still there. Or the curtains had been taken down and they haven't been replaced, or the bed's not made, or I've even heard of situations where the bed's not there because there's been breakdowns in the process. So from the staff perspective, you've got these levels of admission anxiety. And so when we think about the family and resident coming in with their level of anxiety and the staff, and we're meeting for the first time, I mean, I have no idea on Ty's admission day where all the staff were coming from and what they had just been dealing with, but I could tell that there was a level of feeling frazzled and rushed. And so it leads us to think about this question. What kind of energy and experience do you want to create with your new families and staff? And I say with staff as well, because you work as a team. So when we think about we're kind of set up in a suboptimal situation of meeting families and families meeting staff for that very first time, where we want to make a good first impression, but there are these levels of anxiety. So what we can control is the level of energy and our presence in meeting families and residents where they are. And so I think of this image, and there's the dust clouds coming behind, I think it's Pigpen. And imagine your energy, if you could see your energy coming in, what that would feel like for someone. And I'm sure you've all experienced this, that maybe you're in a meeting and somebody comes and joins the meeting and it just shifts the whole energy of the room because they have this vibe of being in a bad mood or being preoccupied. And so I don't know if maybe the DOC just got off the phone with a family member because their loved one passed away. Maybe one of the staff had a bit of a run-in with a coworker, or maybe they were trying to get out the door and their teenage daughter was driving them crazy. And for any of you with teenage daughters, you know what I'm talking about. Who knows what it is, but what we want to be able to be thinking about is, if we're going to have an intentional approach in building trust and partnership with our families, then we need to be able to look at what's within our control. That's our energy and our presence. Which leads me to this. This is actually how I sign off my podcast every episode. There's power in your presence. So make your presence matter. How you show up in any given moment is going to have an impact. So if you're going to have an impact, you might as well make it an impact that you design, that you're intentional with, so that there isn't any room for misunderstanding. And the other quote that I want to share with you is this: please take responsibility for the energy you bring into this space. This is a quote that is attributed to Dr. Jill Bolte Taylor, who is a neurophysicist. She wrote a book called My Stroke of Insight. She was a brain doctor studying strokes, and at the age of about 38, she had a near catastrophic stroke herself and was in the hospital for months. And one of the impacts of this stroke on her brain made her acutely sensitive to other people's energy. If a doctor or a nurse or family friend came in the room and they had that residue, it sent her sideways. So she put the sign in her room: please take responsibility for the energy you bring into this space. And I think it's a great reminder for all of us. We are all responsible. Families are responsible for the energy they bring into your home. You're responsible for the energy that you're bringing into the home. That when we can take responsibility and be aware of it, it can really make a difference. So I'm going to switch gears and talk about, we've covered admission anxiety, and I hope you've had some insights as to the experience from both sides of this key relationship. And I want to talk now about the gaps that I alluded to. And what I've noticed is that there are 3 gaps that occur that when we're able to really focus on and be intentional with closing those gaps, we can really make progress with the transformation and the relationship we want to create. And the first one is the knowledge gap. So when you think about it, for families, they're coming in, they pretty well know everything about their loved one, their likes, their dislikes, their health history, current challenges, what they did for a living. They know their family dynamics, and I'll also say dysfunction, because what family doesn't have at least a little bit of dysfunction? They know all of that you don't yet know. And you, working in seniors care, you know everything about your home. You know your people, processes, policies, protocols, programs. You know your home like the back of your hand. All of these things that are just second nature to you. All of these things that they don't yet know. So you have all of this knowledge that they need, and they have all of this knowledge that you need. And we're not going to be able to just program each other's brains and figure it out immediately. And admission day is overwhelming at best. But recognizing that there is this knowledge gap, and how in part of that, onboarding your families right from the start and help and taking the lead and being the guide, understanding what the critical knowledge gaps are, that when you're able to close them, we'll be able to help reduce the friction and frustration. And also when we get to session 3, how that plays into expectations. So I'm going to share a video of a family member I met a couple of years ago. Her name's Carolyn, and she was moving her aunt into long-term care. And I think she does a really good job of capturing what her knowledge gap was.
I was struck by how cold the orientation or onboarding intake was. And I just thought, well, this is the way it is. This is the way it is. They can't do it any different. This is the way it is. So I felt very lost. I felt very lost. Like, I am stepping into a whole new world. I know zero. And I think when you're in a world that you're so familiar with, you forget that people are lost. And I think I still have this expectation, maybe a hope that the new caregivers coming in, that the home can sort of revolutionize the way that we are doing intake, because I think it would help a lot.
What really struck me with what Carolyn, when she talked about how cold, and part of it, there was a physical coldness as well as emotional coldness in her experience, because she moved her aunt in through COVID, but that a whole new world, and she knew zero. And how sometimes we can forget that new people coming in, they have no idea. And so being able to recognize how to be able to close that knowledge gap. And I think it's important to also keep in mind that families don't know what they don't know, and it's not their fault. It's not their fault that they think that long-term care provides 24/7 one-on-one care. I mean, we know that that's ridiculous. I've even said to families, I don't think you'd want to be tethered to another human being 24 hours a day. But the knowledge gap is that they're thinking they heard or somebody told them somewhere that their loved one would always be watched. So the first time you phone a family member to say your mom's had a fall, they may react with, what are you talking about? You're supposed to be watching her. And the disappointment and frustration that happens is an example of the knowledge gap. Families don't know what they don't know, and it's not their fault. If they think that their loved one's going to get a shower every day because that's what they had at home, they need the education and information to be able to help support them with this big life change that they're going through. The second is the emotion gap. And I think, as I think I mentioned before, sometimes families, and I didn't even realize that I was grappling with all these emotions. I think I was just on hyperdrive and just trying to process everything that was happening. And then being able to recognize that there was a myriad of emotions with the sadness and some anger about the situation and feeling incredibly guilty, as a lot of families do, and looking for that validation that they've made the right decision. And so a lot of this emotion is impacting how they're able to show up. And on the other hand, you've got staff who just 3 days previously likely lost a resident through death, and it could be through transfer, but likely through death. And there's going to be somebody new moving into that room within 48 to 72 hours, and a big adjustment there. And I think one of the biggest gaps with families is that they may not recognize that one of the key emotions that they may be feeling is grief. And it's where I think of it as, you're not just meeting your family, you're meeting their grief. And I didn't realize that a part of it was grief until working with a therapist, where she highlighted for me that there was anticipatory grief, there was disenfranchised grief, grieving the loss of knowing that Wednesday nights I'll be taking my daughter to the soccer game, and her dad's not going to be there with us because he's living in long-term care and he just didn't have the ability to do that. The anticipatory grief of what are things going to look like. And so there are times where sometimes we may have this narrative, which we're going to talk about next week, but a narrative that the family is being unreasonable, or they're having a disproportionate reaction to something that shouldn't be a big deal. And, we're not just meeting the family, we're meeting their grief. And sometimes grief comes out and leaks out in different ways. And being able to have that understanding and appreciation for what is likely underneath the reaction that you're trying to manage. The third is the identity gap. And I want to share this relational triangle, which is in the Now What book, because it's important for families to understand that they are now part of this relational triangle. I was the family member with Ty, and he is my loved one, but he's also now a resident in a community that he is a part of. And we all have this care team now. I mean, I went through so many specialists through acute care, and then home care, agencies, staff, community care, adult daycare. And they were kind of a team, but it did feel episodic. Now Ty's living in a home where he is going to live there, and he lived there for 4 years. And I also am not on my own being the controller and manager of all. There's a care team now that is part of the dynamic. And they're likely going to be spending more time with him than I am. And you've got this care team that from laundry, housekeeping, maintenance, dietary, clinical activities, daily care. I mean, there's a whole SWAT team available that are dedicated to providing that support. And this really resonated with one family member on a family education call that I was doing, because she said, oh, when I moved my mom into long-term care, I mean, I just kept saying, my mom doesn't like it like that. Why are you doing it like that? She doesn't like that kind of food. She doesn't like having her shoes put on that way. And she actually said to me, I could swear that they were just trying to not roll their eyes to the back of their head, as she says, I was getting in their face. And she kind of called herself out as being a bit of a jalapeno, which is one of the family flavors that I talk about in the Now What book. And she said that it was this realization of understanding the relational triangle, that the care team needed time to get to know her mom. They too were adjusting to this new reality, and that they need to work together. And she also was able to understand that even though the care was different than how she would deliver it at home, it was still good care. And as her mother's care needs are going to continue to change, then those care levels and approaches will change. So I think of it like this, that they're not giving up control of their loved one's care. They're taking on a new role as a partner in care. And that may sound subtle, but it is so significant, because caregivers, and I'm sure that the team at OCO would probably maybe nodding their heads on this, as caregivers, we've got a bit of control in our DNA. We have had to, and depends, for how long. I was providing care for years. It was so in my DNA, I had a fear of giving up control and needing to build the trust and partnership with my new care team, who certainly have seen a lot more than I had and have a level of expertise and understanding in how to provide care. And so as soon as I was able to recognize it's not giving up control, it's taking on a new role as an essential care partner with the care providers in the home. So as a recap, we've got the knowledge gap, emotion gap, identity gap. And as we work through in the next couple of weeks, we're going to be referring back to this, because once you're able to have a pragmatic approach about what is the gap, if it's a knowledge gap, then you're going to be able to better construct a strategy on how to close that gap with information, and really understanding what's underneath what's occurring. I mentioned at the onset that with this podcast, The Empathy Exchange, I just want to call out a couple of episodes that I would encourage you to check out. Episode 2 is basically a masterclass in what we've talked about today with the admission anxiety and the family and staff perspective. And episode 3 is an interview I did with Edie Nathan, who is a grief therapist, and she wrote the grief chapter in Now What. So if you want to be able to layer some of the learning, and this is being recorded, so you will have access to that as well, because I know we covered a lot. So as I gave you the heads up at the beginning of our time together, what's the most important idea you got from the session that you'll use in the next 7 days? And I would love it if you would just put something in the chat around that, because also sometimes we pick up different things from different sessions, and there may be somebody in the group that can get something out of the comment that you're sharing. Again, we want to be able to take what we're learning and have it as knowledge and information, but how can we integrate this into how we're showing up over the next 7 days before we meet again in a week's time? So I think what I'll do now is, why don't we open it up for Q&A, and while people are still able to put their comments in the chat, and then we can wrap things up. How does that sound? So I'm just checking to see if Ferdoza, if you wanted to come back on camera. There you are.
There you go. My camera wasn't turning on. Sorry about that.
Okay.
That's good. So I'm going to also stop the recording just so that it's easier for folks to pop on and chat on the chat box as well. And then I'll restart the recording later. Perfect. So on this slide, some of you guys may have heard of our Learning Collaborative previously, but our Learning Collaborative is a forum for care provider organizations that are committed to enhancing caregiver engagement. We do meet virtually every few weeks to share knowledges, challenge, and solutions and tools. So if you're interested in joining our Learning Collaborative, in our summary email, I'll be sharing the registration link on the post-webinar email. Next slide. So on here, I have had some educational opportunities. The first one is the save the date for our with a lawyer that we're hosting on March 5th on privacy and consent. And then for when the date comes, we're also going to share the registration link for that. And then next week, we'll also have our Learning Collaborative on February 22nd on Thursday from 1 to 2:30. Next slide. So thank you so much, everyone, for joining us. Again, please note that we will send you a copy of the video of today's webinar, along with information and resources on our post-webinar. Have an amazing day, and thank you again for joining us.
Thanks, everybody.